Hello everyone, in this session we'll be learning about the musculocutaneous nerve and the axillary nerve. In the previous three videos we had covered about the major nerves of the upper limb, the median nerve, radial nerve, ulnar nerve, okay? Those nerves are frequently asked as long questions and these two nerves may be asked as a short note to you all. That's why we are covering this in this video, okay? Let's start with the musculocutaneous nerve. Musculocutaneous nerve arises from which part of the brachial plexus? It arises from the lateral cord of the brachial plexus. Okay, lateral cord has got three branches. The mnemonic to remember them is LML. Okay, so of which M stands for the musculocutaneous nerve. Okay, and root value is C5, C6, C7. Okay, these are the root values which actually form the lateral cord. Okay, so that's why the root value of musculocutaneous nerve is C5, C6, C7. Okay, then in the axilla, it gives a branch to this muscle, coracobrachialis muscle. Okay, it's a very important muscle that you need to remember because for identification of branches of the brachial plexus, this is the first branch that you can identify by looking at the muscle, and the nerve piercing this muscle is musculocutaneous nerve. Okay. Then in the arm, it supplies the two other muscles of the anterior compartment of arm, the biceps brachii and the brachialis. Okay, these are the three muscles in the anterior compartment of the arm, and all three are supplied by musculocutaneous nerve. Okay, in the arm, it actually lies between these two muscles. Okay, it lies deep to the biceps muscle and anterior to the brachialis muscle. Okay, then it gives a branch to the elbow joint. Okay, so this is an articular branch. Whenever we write branches, we can divide into headings like muscular branch, articular branch, cutaneous branch. Okay, whenever there is a branch going to the joint, you can call it as an articular branch. Okay, then in the forearm, it continues as a nerve called as lateral cutaneous nerve of the forearm. Okay, lateral cutaneous nerve of the forearm. Okay, that's why the name of the nerve is musculocutaneous nerve. It supplies some muscles and it ultimately continues as a cutaneous nerve called as the lateral cutaneous nerve of forearm, which supplies the lateral aspect of the forearm. Okay, then let's see the axillary nerve now. Axillary nerve arises from which part of brachial plexus? It arises from the posterior cord of the brachial plexus. Okay, there is a mnemonic to remember branches of posterior cord. Okay, I've written ulnar here. Ulnar here refers to the mnemonic, not the nerve. Okay, nerve, ulnar nerve arises from the medial cord. Okay, these terms which I've mentioned here, this is the mnemonic for the branches arising from the posterior cord. Okay, out of which A that we can see, that is for the axillary nerve. Okay, what about the other nerves arising from posterior cord? U is for upper subscapular nerve, L is for lower subscapular, then nerve 2 latissimus dorsi, axillary, and the radial nerve. Okay. Details of the brachial plexus, a video is already uploaded in this YouTube channel. Make sure you watch that to get a better concept of the brachial plexus. Okay, link you can find it in the description box below. Okay, then the root value of axillary nerve is this C5, C6. Then it gives a branch to the joint. Articular branch is given to the shoulder joint, and then so on it divides into an anterior branch and posterior branch. Okay, anterior branch supplies this muscle. Okay, deltoid muscle. It's a large muscle surrounding the shoulder. It is supplied by the anterior branches of the axillary nerve, and posterior branch, it gives a branch to this muscle. Okay, teres minor muscle. Okay, deltoid muscle is frequently asked in exam. In practical exams, you need to identify. An examiner may ask you axillary nerve supplies which other muscle. Okay, the right answer is this teres minor muscle. Okay, and then later on it supplies the skin over the lower half of deltoid. Okay, it gives a branch called as upper lateral cutaneous nerve of arm, which supplies the skin over the lower half of deltoid. Okay, this was about the axillary nerve. Let's see the applied anatomy related to both nerves that we learned now. Yes, injury to the axillary nerve will lead to loss of abduction at the shoulder joint. Okay, because the deltoid muscle is responsible for abduction of the shoulder joint. So injury to axillary nerve, the arm will assume the adducted position. Okay, and there is a condition called as regimental badge sign. What happens here? It is the loss of sensation over the skin over the lower half of deltoid. Okay, so for example, if this is the region of deltoid, lower half of the deltoid, there would be loss of sensation, okay, like a badge in that region. Okay, so that's referred to as regimental badge sign. Okay, then injury to musculocutaneous nerve will lead to loss of flexion of the elbow joint because the biceps brachii, brachialis, these muscles are affected. Okay, then area of distribution of the lateral cutaneous nerve of forearm, that would be affected. Okay, the lateral aspect of the forearm which is supplied by this nerve. Okay, so little bit about the course of these nerves, their origin of the nerve, and the related applied anatomy you're supposed to read, because these two small nerves can be asked as a short note for you all. Okay, and please do watch other sessions of this YouTube channel. Link to the PDF of these notes you'll find in the description box below. Thank you.